Go on now to invite Jo Walton to speak next. Jo is the full-time family carer. She works within the Labour Carers Group. She's going to talk about her own long-standing experience and, if possible, some pointers towards what needs to change. So welcome, Jo.
Good evening, friends and comrades. I'm humbled to be asked to speak in such esteemed company, although with all my heart I wish that I did not have the credentials to contribute to this debate, but then I would hazard a guess that the vast majority of us would want as little to do with the care services as possible. Life, however, no matter how careful you are, how well you look after yourself and those that you love, how risk-averse, has an unpleasant habit of throwing curveballs. Whether it's you personally or someone you love, being thrown into that world where the need for care is the only outcome is like stepping into a maelstrom. And at that point, the very last thing anyone needs is to be worrying about what you can afford rather than what you need. I'm speaking from the perspective of an unpaid carer. My name's Jo Walton. I'm a 24/7, 365-day-a-year carer for my adult daughter, Sarah. And here she is. It is as well that we've always liked each other's company, because now we are constant companions, night and day. I didn't ask for or seek the role. It became my life at the age of 50, whilst I was enjoying a very satisfying career. Sarah, the focus of this care, didn't expect my change of role either. Nor what hit her. She was a fit and healthy 25-year-old training in midwifery after gaining a degree and enjoying life to the full in the capital. Completely out of left field, a neurological ticking time bomb exploded and she was left within a year unable to move or speak. We have had 18 years of interaction with our clinical commissioning group through a number of different acronyms and just entering another one with the ICBs. Generally, we've had positive interaction with those staff who've understood the care that we've sought for Sarah to support us to maintain her at home, which is where she and we wanted her to be. For those 18 years of intense involvement with the NHS, we've witnessed the slow degradation of services, the increasingly low morale of staff as they're hit with wave after wave of reorganisation. We've also witnessed the fragmentation and the lack of accountability that privatisation causes. In those 18 years, we have never had a functioning care package, despite the NHS funding being there for it. Too often, I've seen brilliant carers move on because they want a job with proper salaries, terms and conditions, and public respect. We have had that care delivered over the 18 years by 4 different companies, and our experiences spanned national companies, middle-sized specialist companies, and small local companies. We come across similar issues with all of them. They're very big on promising and small on delivering. During the course of time, we've fallen over a number of issues, and I'm going to give you a flavour of some of our frustrations here. The most personal of data is distributed to a multitude of private providers whilst they decide whether they will bid to do the work or not. Those same providers will promise the earth to get the contract but fail to deliver, and if their failure is questioned, they just dump you. Their failures never result in consequences for them. Then there was the day that we discovered that care delivered within the home is not covered by fire orders, as care is when it's delivered in care homes, nursing homes or hospitals. The staff are told to secure the room with the client in it, and in the case of a fire, leave the building and phone for the fire brigade. How on earth can I go anywhere knowing that? Then there's the total lack of knowledge of, or maybe it's a choice to ignore, the working time regulations of 1998. A 9-hour contracted shift without a break is not legal. I could go on, but time's limited, and I know that we're not alone in our experiences. Care services are broken. They've been broken by the fragmentation brought through privatisation and the raiding of the funds provided for those services so that shareholders get them rather than the quality professional services that the users need. There's no room for profit in care. And we, as Prem's already said, we can't go on accepting that we can't afford a national care service. We can't afford not to have a national care service. To paraphrase Bevan, the need for care is neither an indulgence for which people should have to pay nor an offence for which they should be punished, but a misfortune, the cost of which should be shared by the community. In the midst of attempting to care for someone who is suddenly and devastatingly ill, coming to terms with lost futures for the person that we love and for ourselves, the last thing we need is to find ourselves fighting for adequate care. All parties need to listen to those who are involved, those needing the care, carers, care workers, and finish the work which Bevan began. From my perspective, I'm asking that my lived nightmare is resolved and that my daughter's need for care can outlive my ability to deliver it, because the care that will replace it will be every bit as good, in fact, quite probably considerably better. Thank you for listening.